The opioid epidemic is a global health problem that is very prevalent in the United States. Opioids are a class of drugs that include illegal drugs such as heroin, synthetic opioids such as fentanyl, and legally prescribed pain relievers such as oxycodone, hydrocodone, codeine, morphine, and many more. Around the late 1990s, pharmaceutical companies reassured the medical community that prescription opioids would not be addictive, and healthcare providers started to prescribe opioids at higher rates. Due to this, a great amount of misuse and overuse of drugs by patients became a prevalent issue as it became apparent that opioid drugs can in fact be tremendously addictive. Since then, rates of opioid overdoses have continually increased. According to the National Institute on Drug Abuse, in the year 2017, more than a staggering 27,000 people died due to opioid overdose, and more than 130 die per day in America. Approximately 21 to 29% of patients that are prescribed opioids for pain misuse them. 8 to 12% of patients prescribed opioids develop an opioid use disorder, and 4 to 6% of them transition to heroin usage. When thinking about where we wanted to focus our efforts, we thought that we would start here in Butler County since it is close to home. Through our research, we found that in the United States, the average rate of drug overdose deaths as of 2017 was 21.7 per 100,000 people, and the average rate here in Ohio is 46.3 drug overdose deaths per 100,000 people. In comparison, the rate of drug overdose deaths in Butler County is significantly higher at a staggering 70 per 100,000 people. We also learned that the number of annual overdose deaths increased by 125% from the year 2012 to 2017. This solidified our concern for Butler County, and we knew we needed to find a way to help reduce the impact of the opioid epidemic. Some factors that could go into the high rates of drug overdose deaths in Butler County are education, insurance coverage, and access to transportation. Education is a very important factor in ensuring a patient is taking proper care of themselves, especially when it comes to taking opioids. If a patient does not have a strong relationship with their doctor, they may not be receiving the same level of education from their doctor as a patient with a strong relationship with their doctor. Trust between a physician and a patient is also very important. If a patient does not trust their doctor because of a poor relationship with them, they may not be receiving the same quality of education as a patient who trusts their doctor. The amount of coverage a patient gets through their insurance is also an important factor. If a patient has poor insurance coverage or none at all, access to care becomes limited. If a patient becomes addicted to opioids and they have no insurance, they may not be able to access care at an inpatient or outpatient treatment facility due to the high cost. Access to transportation is also a factor that may affect the high rates of drug overdose deaths in Butler County. If a person addicted to opioids is seeking out care and only has access to an outpatient facility and they lack access to transportation, they will not be able to get the care they need. Without access to the proper treatment, a person addicted to opioids may fall deeper into their addiction and can possibly die from an overdose.
When figuring out a possible solution for the opioid epidemic, we wanted to create facilities, needle exchange programs, and transportation solutions for people without access. But when we did research and found out information pertaining to these ideas, it appeared to be way over our $50,000 budget. We had to discuss ideas that would be cost-effective and effective to our issue. We then came up with the idea of the brochure. Brochures provide important information and would promote safe use of drugs. Brochures are tangible in ways that people can keep them on their person. You don't need internet access to read the information provided on it unless wanting to use the websites listed. And brochures are fairly cheap. It costs around $2,000 for every 20,000 copies of this brochure. We plan on starting off on purchasing 100 copies of this brochure, totaling at around $10,000. We looked at the number of specific pharmaceutical facilities, and there were 9 CVS stores, 5 Walgreens, 15 Kroger pharmacies, 3 Walmart pharmacies, 1 Meijer pharmacy, and 5 community pharmacies in Butler County that this brochure could potentially be passed out to. We decided on starting out with this number because with the total amount of pharmaceutical facilities being at 38, each facility would get around 3,000 brochures to start out with. We wanted to give these brochures out when people are prescribed opioids to ensure that the people being prescribed the medications know how to properly use opioids and to take the necessary precautions. When deciding what information to put on the brochure, it was important to put information that was safe and effective. We knew that the use of opioids is somewhat inevitable and that the best way to reduce the opioid epidemic and the spread of other diseases was to inform people of proper and safe usage. The front and back side of the brochure talk about what opioids do and the different types of opioids commonly used and prescribed, so people are aware what medications are classified as opioids. On the back of the brochure, on the very top, is a list of facilities that help with substance abuse in the major cities of Butler County, facilities in Hamilton, Fairfield, Middletown, and Harrison. We tried including at least one facility from the major cities so people across the county had access. When looking at the inside of the brochure, the left side gives ways of preventative measures that pertain to opioid safety. It touches on talking with your doctor, ensuring you are using the amount of medication prescribed, and not mixing the medications with other substances, such as other drugs and alcohol. The left side also includes how to safely dispose and store opioids. This is an important part of taking this kind of medication because if not properly stored and disposed, it can induce other addictions and health effects. Safely disposing and storing opioids prevents others from getting into the medication, such as children and friends. It can also protect the environment from harmful exposure to the opioids. There are 2 links for Walgreens and Kroger that talk about the proper disposal and take-back programs underneath disposal methods. Looking over the right side of the brochure, it was important to include facts about Butler County specifically. There are 2 needle exchange programs in Middletown and Hamilton for people who do use and want to use safely. This does not encourage the use of drugs, but prevents the spread of HIV and hepatitis C. This information is important for those who may not know that there is clean needle access near them. These needle exchange programs also provide testing of HIV and hepatitis C to prevent the spread and bring out awareness. There is also a list of common substitutes for opioids that will decrease addictiveness, such as acetaminophen and ibuprofen. Along with needle exchange programs, there are graphics pertaining to Butler County. It shows which cities are most effective, and Hamilton was the city most effective. There were 679 deaths per 100,000 associated with drug overdose. Specific facts bring awareness to the subject.
To measure the sustainability of our brochure, we decided to create a website that we will put a link to in the brochure. On the website, we will provide access to all of the same information that can be seen on the brochure. We will also attach a link in the website to an anonymous Google survey that people can opt to fill out if they would like to. The survey will have a few statements on it that participants can gauge how much they agree or disagree with, and 2 open-ended questions that allow for feedback from the participants. About 1 month after we distribute the brochures, we will look over the survey responses to measure the success of the brochures. If we receive positive feedback on the brochures, we will know that we should continue to distribute them. From the feedback we receive on the open-ended questions, we can make adjustments to the brochures so that the information provided on them aligns more with what participants felt would have been more beneficial to them at the time. We will then distribute the new brochures, which will also have a link to our website and a survey so that we are continuously receiving feedback. From there, we will create a new brochure every 3 months so that our information is kept up to date and pertinent to what people feel benefits them. We will hit our $50,000 cap 10 months after we distributed the first round of brochures. At that point, if the brochures are still successful and helpful for the people of Butler County, we will reach out to Shatterproof, a nonprofit organization that works to reduce the effects of the opioid epidemic, and try to work with them to continue to distribute our brochures to Butler County and possibly other parts of America. We know that our project cannot completely stop the effects of the opioid epidemic in Butler County, but we hope it reduces the impact for years to come.